What we found in West Cheshire is that clinical leadership has actually been crucial in developing our clinical commissioning group. It's changed the culture of the way that we commission services, and it's brought that added value. And it's clinicians which have that understanding of what matters to patients. We've got several clinical leads within our clinical commissioning group, but I'd like to introduce just two of my clinical colleagues who will talk about how they have led change. First, Dr. Claire Westmoreland on patient and public engagement, and then Dr. Martin Dennis on alcohol services.
My role is a new one. It's been developed over the last 18 months or so and is intended to really reflect what we are as a clinical commissioning group, putting patient engagement and experience at the heart of everything that we do. Engagement for me as a GP is about listening, communicating and informing patients, whereas experience for me as a GP is about taking what patients say and actually using it to influence the decisions that we make about their healthcare. That ethos for us as a clinical commissioning group needs to thread through everything that we do. For me, as a GP, a good patient outcome is just as important as a good clinical outcome. And I think the most important thing is to remain open to feedback, open to comments, open to criticism, and using that information to inform what we do as clinicians, putting patients at the heart of their healthcare. So it really is no decision about me without me.
We believe that we have about 8,000 patients who are dependent on alcohol, but also we have 64,000 who are drinking in a way that will harm them, and a quarter of those we believe are drinking in a risky way. Year on year, we've seen an increase in hospital admissions. The public health departments worked out a case for change, which looked at ways of improving services for patients, but also reducing the costs both in the short term and the long term. My role has been to make sure that that case for change has been adopted, and so we will be delivering better services for patients with alcohol problems and cutting costs in the short and the long term.